Hi, my name is Ian Khan, and you're listening to the Innovation Times podcast. I am a technology author, speaker, and an advocate for everything good that technology brings. A part of my work is running the Innovation Times podcast and bringing together people from various aspects of the industry and talk about how technology is affecting the way that they perform their jobs, their functions, and how they're leading their organizations through change that's propelled by technology. As part of my podcast, I interview people from all segments of the industry and different verticals as well. Welcome to Innovation Times.
Hi, this is Ian Khan with the Innovation Times. Today I have a very exciting guest, and I've been waiting to interview her for a very, very long time. Mariann Yeager is the CEO at the Sequoia Project. Now, Sequoia is a nonprofit public-private enterprise that sits in between a lot of different places and entities because they make these connections possible. The Sequoia Project supports health IT interoperability initiatives, and they're really the country's largest health data sharing network, serving, I believe, about approximately 100 million patients. So without any further ado, I'll start the conversation with Mariann because we have a lot of questions to ask her. Mariann, welcome to Innovation Times.
Oh, well, thank you, Ian. It's a real pleasure to be here.
Thank you so much. So tell us about Sequoia. I've heard so much and I have so many questions, but tell us, what does Sequoia Project do? And I know you guys have gone through a brand change in the last few years. How did that come about, and where does Sequoia fit into the industry today?
Well, sure. Well, the Sequoia Project is a fairly unique role and a unique beginning in that the company was started as a nonprofit, but with a public mission. And that was important because at the time the company was formed was to take over stewardship of an initiative that was sponsored by the U.S. federal government, the Department of Health and Human Services, where they had incubated what they hoped would be a nationwide health data sharing network. And then, over time, as that effort grew, the company was formed to become a steward of it. So we basically serve as a corporate home for multiple interoperability initiatives. Interoperability is our core aim. And in terms of advancing interoperability and of course, an aim with the public good.
And you mentioned the keyword interoperability. Today, the healthcare landscape is really, really complex because within the United States, there's multiple entities, there's different systems, there isn't a single payer system in place. So there's a fair bit of complexity in place when we talk about how the healthcare industry functions at the back end. Help us understand what the landscape looks like from a technology perspective when you're talking about connecting different entities and their issues and their billings, and there's so many different connections. How can an average person understand this complexity?
Well, sure. So again, our aim is really to enable secure nationwide sharing of health information across the many different geographies, many different technology platforms, and as you mentioned, Ian, an extremely complex environment. So in the U.S., there are hundreds of different health IT technology platforms that are used both in delivering care and as well as in health plan systems and across the healthcare delivery system. And our goal was really to figure out how do we enable the sharing of data across this very fractured, diverse ecosystem, and to identify approaches that would both respect innovation and allow innovation to occur at the edges, but to find that common dial tone. That's what we sort of refer to it as sort of what is the foundational in terms of finding the appropriate standards and policies and capabilities that allow data to flow that works in a way that is technology neutral as much as it can be, that's open standards based, and that allows room for adaptation. So the ecosystem in the U.S. is, of course, very diverse geographically. So there are, different approaches within different regions, even within, and across different 50 states and territories. But even at a national level, if you think of national level health plans and the federal government, they themselves have their own approaches. So our goal for really solving that issue is really facilitating consensus across industry and governmental partners to agree upon a standardized way to share data, a common set of rules of the road, and really to address issues around data governance and privacy and security and technology as well.
Excellent. Now, I have privacy and security of information as a big point that I wanted to ask you about. If you look at how information is being shared today, there's a lot of talk about big data and how big data is going to help us change a lot of things we do with this information that's being shared. But then on the other hand, the pure fact that we are sharing our personal information with third parties or vendors or hospitals, how does that play a part in this information not being secure? Should consumers, or let's say patients, be aware of certain things that they can do to keep their information private? Or how would you really define privacy? What is our concept of privacy, and how do you look at privacy from where you stand?
Well, as you can imagine, when you're trying to address and enable health data sharing across an entire country of 300 million patients, really the way that data is enabled to flow is when there's trust. And in order for different data sharing partners, providers, health systems, governmental agencies to have trust in exchange partners, some of whom they may interact with directly, others who they have no working knowledge at all, really you start with privacy and security and the underpinnings of transparency and data governance. So that's really, if we look at the work that we have supported here at Sequoia, and certainly the beginnings of that work within the federal government here in the U.S., focusing on what are the minimum expectations for privacy and security, assuring that there are appropriate security protocols employed to assure the data are encrypted, and really establishing expectations around consent and in terms of how is consent addressed and facilitated when there are different requirements, again, in all these different geographies around and different programs, particularly with the federal government. Mm-hmm. And really codifying those expectations in a legal agreement so that it's clear to all data sharing partners what those expectations are, both around how the data will be safeguarded, approaching secondary uses, and having accountability and governance mechanisms in place so that if there is an incident, that there's cooperation across the different partners and that there are mechanisms for really resolving incidents and also potentially even suspending a connection if there are issues aren't resolved. So it's at the heart of everything that we do. It's actively not just addressed and spelled out up front, but that active governance is a key part.
Mm-hmm. And as this ecosystem, let's say, brings on, and I'm talking about from my perspective, is as you bring on more partners or more parties that are part of this ecosystem of enabling healthcare services, whether they are a drug manufacturer or a healthcare facility, there's definitely this exchange of information, and there's it's much more complex than we think it is. I mean, people always talk about, the policies need to be changed, and there's this whole. I was speaking at a healthcare providers payers conference a few months ago, and there's this whole discussion about Obamacare, Medicare, Medicaid, and that was just a conversation at the tip of the iceberg, because I think there's a lot more complexity when we talk about policy and technology. Now, within technology circles, and I want your insights on this, is policy and technology are two variables that really are complex. On one hand, we're making strides in, let's say, from the technology side of things, where we have new technologies such as, say, blockchain that is, gaining a lot of traction right now. But then we also have to hold ourselves back from policy perspective, and we can't really go out and implement everything on a single given day because of the scale. Do you see technology being held back because of policy, or do you think it's actually a good thing that policy dictates how technology gets enabled within the sector?
Well, we like to say that the issues and challenges that are largely encountered are those that are policy related and not so much technical. But I think that's why the work that we've been facilitating, supporting over the past, 8 years or so, really has gained traction, because we've been able, again, through this public-private process, to identify the key components of policy that have to be consistent for data sharing nationally, and really where it's appropriate to have respect for local policies. So in the U.S., for instance, there's very different approaches for obtaining an individual's consent. Some are opt-out, some are opt-in, and there's no single national level approach in the U.S. So that's an area, because of that complexity and the disparate approaches, that the technological solution was really around, well, how do you support policy? Maybe it's appropriate to convey the permissions, for instance, so that a data sharing partner can determine how to respond to requests and the like. But there are also important technical challenges that, again, in our experience, is if the more specificity you have around technical specifications and requirements, that leads to less variability in different implementations, that there are plenty of technical challenges as well. But if you get the policy right, then it makes it a lot easier to execute on the technical side.
So are there any specific technologies, without going into the technical side of them, are there any specific technologies that you're looking at as influencers on the industry for the next, let's say, 5 or 10 or 15 years? And, blockchain is such a huge part of conversations today, and this question is kind of towards blockchain. It could be about other technologies as well. What do you see creating an impact from a technology perspective within the industry?
Right now, I think the biggest impact we're seeing in terms of new technologies, certainly there's great interest in blockchain, and there are a lot of unknowns still. So I think that one is certainly one to keep an eye on. But there's a lot of momentum and energy around the use of web services protocol based on RESTful approaches. That's called FHIR, F-H-I-R. It's an HL7 standard, and that's gaining a lot of traction. There are new efforts underway that make it, for instance, to use that as a mechanism for developing a healthcare directory. We're seeing firsthand that using these more modernized standards is actually accelerating development timeframes. And again, I have a feeling, just, if you're really thinking about the 5-10-year horizon, that there's probably something on the horizon that we haven't even contemplated that could be really monumental. So we're certainly keeping our eyes out for what's coming.
Absolutely. And I was speaking to, you mentioned FHIR. I was speaking with Dr. David Hay of Orion Health a couple of months ago, and he's doing a lot of work on FHIR, very passionate about FHIR. So it's Chris Hobson, I spoke with him just some time ago from Orion as well. So a lot of different conversations about FHIR, the protocol, and how it's changing things. So definitely that is something that's gaining momentum a lot more within the healthcare space. Now let's shift the conversation a little bit more towards Canada. I know you're attending the Canada InfoWay conference just a few months from now that's coming up. How do you see the Canadian side of the healthcare industry being strong or being weak? What is your opinion that where's Canada with respect to connecting the dots and being ahead within technology?
I've had the pleasure of talking with the folks at Canada Health InfoWay at different intervals, and I've always been so impressed, with the work up there in Canada. I think you all have such a unique opportunity, and having, government-supported approaches, and really having, I would say, the financial backing of being able to support national-level approaches. So we think it's very synergistic. We like to learn from our neighbors up north, and really try to bring to bear our own experiences. And I think there's a wonderful opportunity to really continue that sharing of experiences and hopefully enable, who knows, data sharing between the U.S. and Canada. Wouldn't that be great?
Absolutely, and it would be a colossal project when you talk about managing that information and doing that. Talking about different regions and what they're doing, there's a lot more. There's a lot that I see happening within other regions. As an example, I frequently am in the UAE, and Dubai really has embarked on a mission to make blockchain as their de facto standard behind every government department. So they're aggressively pushing that, and I think the ease of scale is on their side because the number of patients that they're potentially looking at is less than 3 or 5 million, but it's not 30 or 300 million. So I think that simplifies the challenge for them a lot more, so they can potentially embark on this a lot more easier than we can. But what about the rest of the world? Any insights on what's happening in the rest of the world where they're really making strides in technology within healthcare or innovating within healthcare, and where we should learn from?
Well, I think there's so many experiences to bring to bear. I think that there are some very interesting activities, of course, in Europe, where we've spent time really, again, sharing lessons learned with our EU counterparts. And I think that there's really experiences that we can really garner from lots of places in the world. It's interesting. I was talking with a group that was supporting some new government-led initiatives in Africa, and they were just noting how their issues and concerns, because they're really starting from scratch in terms of looking what they need around, in terms of health IT and data sharing, and had different sensitivities around privacy and security that were very different from those in the U.S. And in some ways, I think these other parts of the world, particularly those that may not have already have an existing investment in health IT, might be able to actually leapfrog ahead of where we are in the U.S., because we are very much working from the technology investments that have been made over the past 20, 30 years. So I think that there are lots of really interesting places we should be looking to for lessons learned.
Very exciting. I'm definitely looking forward to us doing more in North America, and we are, but there's different challenges of different sorts. I know we're running out of time here. I'm going to ask you just one last question and really help our listeners understand what the future brings in your capacity, and how you see the entire framework of healthcare, again, through technology, through non-technology means, again, also keeping in consideration the challenges that we have. Where do you see us by the year 2030? And that's just one of the timelines that I'm putting up. 2030 seems to be, it's not too near, it's not 5 years from now, and it's not 50 years from now. So I think 2030, if you will, seems like a nice futuristic place to be. What do you see happening with respect to technologies such as artificial intelligence or Internet of Things or blockchain? But where do you see us in the next 15 to 20 years? Let's say 2030.
Well, I think that it's the issues that we sort of focus on today will probably we'll look back and question why it seemed so complicated at the time. And so I think by that time frame, and it's just 13 short years, I think we may actually have different technology altogether in terms of how data are moved. But I think we'll have a mix of existing technologies and a blend of new technologies with a way for information to be shared in a much more liquid way. I think that as consumers, we will be able to use whatever mechanism device that we want to more readily access our information, and to be more of the console, the center point for health data sharing, and be more informed. I think there's, in that respect, I think there's a movement here in the U.S. And I'm hopeful that by 2013, we'll actually see that movement of consumer access and consumer directing where their data goes will be much more of a reality.
Well, thank you so much for your insights, Mariann. Please tell us, where can we learn more about the Sequoia Project and get more information about you guys?
Well, sure. You can always look at our website, www.sequoiaproject.org. And all of our work is very transparent, so you'll find resources on our respective initiatives, not just information about us, but also the work that we support. And we really just encourage those who are interested in engaging, participate. And if you have suggestions and ideas of new interoperability problems we can work on together, we would certainly welcome that as well.
Well, thank you so much. These insights have been invaluable for our listeners. Again, look forward to an opportunity to meeting you, and keep up the good work. And thank you so much for your time today.
All right. Thank you, Ian.
If you're confused about the current state of technology and the impact that it has on the world, then you are at the right place. My name is Ian Khan. I'm an author and a technology speaker who focuses on the value created in the current world. I talk about ideas, thoughts, and value creation in general that helps us propel ourselves into a future that's driven by technology. The Internet of Things, blockchain, artificial intelligence, cloud are all means to create value. Technology in general is an enabler for positive business outcomes. If you're confused about the outcomes that technology can create for you, then you're at the right place. For more information, you can always visit me on my website at www.iancon.com or follow me on social media on Twitter at IanConLive. Let's change the future by creating a value, nothing else. Let's just change the future by creating more value. That's what I stand for, and that's my message.